And the final medication that I'm going to demonstrate is the inhaler, or the nebulizer. We're doing the nebulizer. So first thing we're going to do is wash our hands. You're going to identify and gather your supplies. So depending on the age of your child, you have 2 different pieces of equipment. We have our medication. We're going to use our asthma action plan. And we have our monthly medication record. Okay, so we've gathered our supplies, and we are going to compare our medication container to our monthly medication record for our first check. So we have Joey Doe. We have an albuterol sulfate nebulizer solution. It's 1.25 milligrams per 3 ml unit dose vial. We're going to give 1 vial via nebulizer every 4 to 6 hours as needed for asthma. Our monthly medication record, this is for Joey Doe. It's an albuterol sulfate nebulizer. We're going to give 1 dose vial by nebulizer every 4 to 6 hours as needed. We have the parent authorization form for Joey Doe. We're going to give the albuterol sulfate nebulizer treatment. We're going to give 1 unit dose vial every 4 to 6 hours as needed by mouth using the nebulizer. Possible side effects are dizziness, headache, cough, nervousness, rash, sore throat, and nausea, and this is to relieve asthma symptoms. We'll check the expiration date, and this medication is not expired. And we're going to ask an assistant to help us maybe sit with Joey, or if it's an infant, hold Joey, and we're going to do our second medication check. So we have the albuterol sulfate nebulizer solution. It's 1.25 milligrams for every 3 mLs unit dose vial. We are going to give 1 vial via nebulizer every 4 to 6 hours as needed for asthma. And on our monthly medication record, this is for Joey Doe. It's the albuterol nebulizer. We're going to give 1 vial every 4 to 6 hours as needed, according to the asthma action plan. And we have the parent authorization form signed by Jane Doe for Joey to receive 1 vial of albuterol sulfate via nebulizer every 4 to 6 hours as needed for asthma symptoms. So we are going to take our medication and our supplies to Joey and explain the procedure. And we will do our third medication check. And we have the albuterol sulfate nebulizer solution. We're going to give 1 vial via nebulizer every 4 to 6 hours as needed for asthma. That matches our monthly medication record and our parent authorization form. So we are going to put on our pair of gloves, and we are going to position Joey comfortably. And for an infant, you would place the mask over their nose this way. For an older child, they're going to inhale like this and close their mouth around the end of your tubing. So for the mask, you'll ask the child just to sit and take deep breaths. And for the tubing, you'll ask them to place the mouthpiece in their mouth and inhale slowly and then exhale through their nose. So one thing that you'll want to be cautious of is that sometimes the nebulizer can trigger coughing or vomiting. So you might want to have tissues or a waste paper can just in case you might have a mess. Have the assistant remain with the child for the duration of their nebulizer treatment. You can remove your gloves. You're going to wash your hands. And we will document that we gave the medication and we'll say 2 p.m. for the asthma symptoms, and you're going to document the asthma symptoms as well as whether or not you're going to document if the symptoms were relieved on their asthma action, according to their asthma action plan. So we can return any unused supplies to the medication storage area. And we are going to clean our medication administration area and observe Joey for any adverse side effects.